champion freestyle skier Sarah Burke. She is in critical condition right now after an accident on a training run left her with a traumatic brain injury.
And this morning, she's in a coma.
Ann Quinlan is still alive by all legal and medical definitions. This means Karen has some brain waves and she responds to heat, light, pain, and touch.
Do you want to stay here for the rest of your life? Huh? Come on. Come on, snap out. Snap out of this dream world. The real world is outside your body. You're living inside your body. You're living inside that body. You want to live here for the rest of your life? You want to live with your family, don't you? You want to live with your family? You want to stay here at Metaplex for the rest of your life?
No. My name is George Ford. This production is about my wife, Elizabeth, who collapsed at home. It was discovered that she was unconscious. There was no pulse. She was not breathing. I called to my son to call for the police department, for an ambulance. The police department arrived shortly after and assisted me with CPR. The paramedics arrived and defibrillated. A heartbeat was in place. She was then taken to United Hospital in Portchester. I explained that she collapsed, and I estimate that she had not been breathing from anywhere from 2 to 4 minutes. She was brought up to the intensive care unit at the hospital. The next time I saw her, she was on a ventilator. The second day on command on the ventilator, she raised her arm. She was not in a coma or a vegetative state. A couple of days later, she appeared to go back unconscious and probably back into a coma. It was discovered after death that my wife Elizabeth was in hypothermia for 18 days in the critical care unit. It was said at the critical care unit that she has to be extubated because the intubation tube can cause tracheal erosion. It was also said that she would probably die. She was extubated and didn't die. Well, I have to draw the conclusion that the brainstem was functioning. She was continued on oxygen by way of large bore nebulizer. She remained at United Hospital for 2 months and 5 days. It was said that they could do no more for her. A nursing home was suggested in Stamford, Connecticut. She went on to the nursing home and was continued on oxygen, moisturized oxygen, by way of large bore nebulizer at the nursing home. At 2 years and 2 months, I did discover that the moisturized oxygen was 34% lower than the normal body temperature. It exited the nebulizer head at 59 degrees Fahrenheit. In removing the hose at the T-piece, it was discovered that the moisturized oxygen temperature was 63 degrees, 34% lower than the normal body temperature. The oxygen should have been heated all along. This model represents a patient in a vegetative state. The patient is receiving moisturized oxygen from a large bore nebulizer. Leaving the nebulizer head, the moisturized oxygen is 59 degrees Fahrenheit. It runs through roughly 10-foot of hose. The oxygen now passing the trach tube is at 63 degrees Fahrenheit. It has been proven on live human subjects that 71.6 degree air is enough to cool the brain. I will now show how the patient should have been treated. The patient should have been receiving oxygen from a large bore nebulizer with a heater on the nebulizer, which will heat 59-degree moisturized oxygen to body temperature. This thermometer in place, in line, will show the actual temperature of the moisturized oxygen passing the trachea. Without the thermometer, there would be no way of a caregiver to know the temperature of the moisturized oxygen. This is a trach tube that goes into the trachea. It took the place of all of the equipment behind me once the oxygen was stopped. It is estimated that the cost to maintain these patients in a vegetative state, $1 to $7 billion. Months went by. I fought with them to either stop the oxygen or heat it. They refused to do both. At 2 years and 8 months, my wife went into pneumonia again, probably for the 6th time. My wife left the nursing home and went on to Stanford Hospital in Stamford, Connecticut. At the hospital, the pulmonologist approached me and said, "I understand you think your wife is in hypothermia." I said, "Yes, lungs, heart, and brain, more so the brain." I asked him the temperature of the moisturized oxygen. He answered back, "Room temperature." I said, "Doctor, that is not what it is. It's 63 degrees, which is much lower than room temperature, 68 to 72 degrees. It was said by him, the doctor, "We will trial her off the oxygen." I said, "How nice." I asked for this over 6 months ago. It was done successfully. The blood O2 level remained at 97, 98, which is very acceptable. She went back to the nursing home after 5 days, still on medication for pneumonia infection. I said, I will wait 1 month for 2 reasons. One, for the medication to finalize and the brain to warm. 1 month after stopping the oxygen, I walked into the room and said, "Elizabeth, your brain is now warm. You should be able to talk. I want you to say 1 word for me. Say no." I said that about 5 times, gently slapping her in the face, figuring that she may have been stuporous. I said, "Can you say no?" And she answered back, "Yeah, why?" and started coughing fiercely. Testing 1, 2, 3. Testing 1, 2, 3.
Come on. Say no. No. Come on. Just say that 1 word, no. Say no. Can you say no?
These were the first 2 words she spoke in 2 years and 9 months. This was brought to all caregivers and many doctors that came into Metaplex. There was no comment whatsoever. After stopping the oxygen, she spoke, and once again I played tapes of my wife talking. Still no comment. The culture of silence kicked in all the way. Many people at that facility knew there was a major mistake in not heating the moisturized oxygen. Another time I said, "Elizabeth, you feel like talking?" She literally hollered at me, "No." I started laughing. I said, "Why don't you feel like talking?" She says, "I don't wanna." I said very softly, "Why don't you wanna?" She said, I don't know.
What are you trying to tell me? Huh? Do you feel like talking?
No.
And why don't you feel like talking? Huh? Why don't you? What, you don't wanna? Why? Huh? Why? 'Cause you don't feel good, that's why.
This was also played for the caregivers. Still no comment. I fought for years for doctors to look at my wife. In speaking to anywhere between 800 and 1,000 doctors and nurses of every specialty, the question was asked. A patient is receiving oxygen from a large-bore nebulizer directly to a trach tube, 28% oxygen, 6 liters blow-by. What is the temperature of the moisturizer oxygen? 99% of the doctors said room temperature. Room temperature is considered to be 68 to 72 degrees. We all breathe room air. Yes, we all. But patients that have trach tubes are breathing 63-degree Fahrenheit air directly into the trachea. It is proven that 71.6 degree air on an intubated patient is enough to cool the brain. I draw the conclusion that the carotid artery blood going to the brain is cold, causing the vegetative state. My wife passed away 7 years and 22 days after the original insult. I am not a doctor. I am not a doctor. I don't have a voice to present my research. But it was published in Medical Science Monitor, which is a peer-reviewed journal. The name of the document is Prolonged Unintended Brain Cooling May Inhibit Recovery from Brain Injuries, Case Study and Literature Review. This document indicates that patients with trach tubes are receiving oxygen that is 34% lower than normal body temperature. I have in my hand a book, Patient Care Standards, Nursing Process, Diagnosis, and Outcome. On page 196, ongoing care, equipment, use sterile distilled water in nebulizer. Check water level in reservoir every 4 hours. When adding water, empty reservoir, then fill to the correct level. Free tubing of excess moisture every 2 to 3 hours. Check heat control every 2 to 4 hours. Maintain temperature between 95 and 97.8 degrees Fahrenheit. In all probability, there are hundreds of thousands of patients over the years that have been treated the same way. No heater. Respiratory Care, A Guide to Clinical Practice, 2nd edition. On page 389 of this paper, Sykes and co-workers recommend oxygen between 80 and 100% relative humidity and at 37 degrees centigrade for patients with artificial airways. The Science Journal of American Association for Respiratory Care. Clinical Practice Guidelines. This paper also indicates that moisturized oxygen should be heated to body temperature when a patient has a trach tube receiving the oxygen from a large bore nebulizer. Preservation of humidity and heat of respiratory gas in spontaneously breathing tracheostomized patients. I will read one brief statement on this paper. Tracheostomy, or endotracheal intubation, bypasses the upper airway and the normal heat and moisture exchange process of inspired gases. Therefore, Humidification and heating of gas is widely accepted and practiced in the intensive care unit. Failure to achieve and maintain an adequate humidification may predispose patients to severe airway damage, destruction of ciliary and mucous glands, decrease in surfactant and ciliary transport, and heat loss, drop in body core temperature. It appears that doctors and nurses are not aware that they are cooling brains. From the Royal College of Nursing, the name of the paper is Tracheostomy, Suction and Humidification. It states here, the upper airway of a patient with a tracheostomy has been bypassed. This means that both the warming and humidification of air and normal defense mechanisms, coughing, and mucociliary transport are adversely affected. During quiet respiration, inspired air, the water content of which is usually less than 25%, is warmed and humidified through the nose. By the time it reaches the nasopharynx, it has been warmed to approximately 37 degrees and is fully saturated. The trachea, however, is ill-equipped to warm humidified inspired air, so the presence of a tracheostomy causes cold, dry air to reach the bronchi and lungs. This paper proves that moisturized oxygen should be heated to 37 degrees centigrade, 98.6 degrees Fahrenheit. Nursing care standards state that the oxygen should be heated. Respiratory guide state that the oxygen should be heated. AARC guidelines state that the moisturized oxygen should be heated. I have a ventilator report. While my wife was receiving oxygen by way of intubation tube in the critical care unit, this report states temperatures. The temperatures I'm reading are 33, 33, 33, 33, 34, 31, 33. These are all hypothermia numbers. For every 1 degree into hypothermia, cerebral blood flow ceases 6 to 7%. Therefore, the brain was started to be cooled at that point in time. I have a hospital report from United Hospital Medical Center. It's a discharge summary. In this report, it states, at time of discharge, white count was 12.9, hemoglobin 12.5, SMA 12. It states stool for occult blood was negative. Drug screen was negative except for opiates, which was explainable in that she was taking Tylenol with codeine for back pain. I must emphasize that the last time my wife took Tylenol with codeine was 2 months prior to this report. There's only one way that the body would show opiates. She was in hypothermia for the length of time that she was at United Hospital. The opiates conjugated in the liver. I assume many patients are out there all over the country and possibly all over the world that are being treated the same way my wife has been treated. It has to stop. I have 3 papers from 3 separate journals. The first paper is Journal of Applied Physiology. The title, Direct Cooling of the Human Brain by Heat Loss from the Upper Respiratory Tract. The second paper is from Intensive Care Medicine. The name of that paper is A Novel Approach for Selective Brain Cooling, Implications for Hypercapnia and Seizure Activity. The third paper, Effects of Pharyngeal Cooling on Brain Temperature in Primates and Humans. All 3 papers indicate that when the airway is cooled, The brain will be cold, but the core can be warm. In all probability, the issue of brain cooling is the primary cause of vegetative state. This issue was also brought to the New York State Department of Health, the Connecticut State Department of Health, the National Institute of Health, the Agency for Healthcare Research and Quality. No interest. I have a letter that was sent to me by the State of Connecticut Department of Public Health. This paper describes what the Connecticut State Department of Health advised me of after I brought to them my conclusions that there is a failure to heat moisturized oxygen to body temperature. I strongly believe that they are wrong in all of their conclusions with the statements on this paper. This paper here is also from the Department of Health, but it is from the State Department of Health of New York. The reason the State Department of Health was confronted on this issue is because it all started at a hospital in New York State, Westchester County, United Hospital in Portchester, New York. I have another paper from the State Department of Health of New York, which is dated April 27, 2009. This paper disputes all of my research relating to coma vegetative state. This book here is about Ann Quinlan back in 1975. In the book, it shows reports on methods of treatment, respiratory management, tracheostomy area cleansed and covered with antibiotic ointment at least every 8-hour shift. Trachea suction as needed for removal of excessive secretions. Patient to breathe room air with no external mechanical assistance, but air is humidified by machine delivering water vapor through a tube connected to the tracheostomy. Again, room air is 68 to 72 degrees. This DVD, Coma, was produced in New Jersey. It shows one specific patient receiving oxygen by way of large bore nebulizer. No heater. This issue of non-use of nebulizer heaters is going on in many parts of the country, maybe all of the country. How many more patients will be progressed into vegetative state? How many more will die?
Snap out of this dream world. The real world is outside your body. You're living inside your body. You're living inside that body. You want to live here for the rest of your life? You want to live with your family, don't you? You want to live with your family? You want to stay here at Metaplex for the rest of your life?
No.